The United States is currently grappling with its largest measles outbreak in more than 3 decades, a situation that has alarmed health officials and communities across the nation. The resurgence of this highly contagious disease is raising urgent questions about public health and vaccine coverage. So far, more than 1,200 cases have been reported, spanning 38 states and affecting people of all ages. The rapid spread of the virus is being tracked closely, with new cases emerging almost daily in both urban centers and rural communities. Measles, which was once declared eliminated in the US back in 2000, is now making a troubling comeback. This resurgence is largely driven by declining vaccination rates, fueled by misinformation, vaccine hesitancy, and access issues in certain areas. Communities that once felt safe are now facing renewed threats, and schools are seeing increased absences as parents worry about exposure. The CDC has issued urgent warnings, noting that this year's surge is approaching the record set in 2019. Unlike previous outbreaks that were mostly contained to specific regions, this time the virus is spreading widely, making it a truly national concern that demands immediate action. Health officials are working tirelessly to contain the outbreak, deploying emergency response teams, setting up vaccination clinics, and urging the public to get immunized. However, the measles virus is so contagious that it often spreads before cases are even detected, making containment a race against time. This outbreak serves as a stark wake-up call, threatening to undo decades of progress in disease prevention. It has reignited heated debates about the importance of vaccination, public responsibility, and the role of misinformation in shaping health decisions. In the next segment, we'll take a closer look at the hardest-hit regions, identify which groups are most vulnerable, and explore the reasons behind the resurgence of this preventable disease. The fight against measles is far from over, and understanding the challenges ahead is crucial for protecting our communities. West Texas is the epicenter, with 750 of the nation's cases traced to this region alone. Local health systems are overwhelmed, and most patients are unvaccinated children and teens. This isn't a vaccine failure, it's a failure to vaccinate. Low immunization rates in schools and neighborhoods created the perfect storm for measles to spread rapidly. Emergency vaccination drives are underway, but the outbreak has disrupted daily life, closed schools, and strained hospitals. Texas's crisis is a stark warning. When community immunity falters, measles returns with force. The lesson is clear: declining vaccination rates have real immediate consequences. The human cost of vaccine-preventable diseases is truly devastating. Recently, 2 unvaccinated children in Texas lost their lives to measles, a tragedy that has shaken their families and communities to the core. In addition, an adult fatality was reported in New Mexico, underscoring that measles can be deadly for people of all ages, not just the very young. These heartbreaking losses mark the first measles deaths in the United States since 2019. What makes these deaths even more tragic is that they were entirely preventable, had the individuals been vaccinated. For every child who dies, there are many more who end up in the hospital, fighting for their lives against severe complications. Pneumonia, brain swelling, and even permanent disabilities can result from measles infections. Families are left to cope with overwhelming emotional pain, and often crushing financial burdens as hospitals fill with young patients needing urgent care. Doctors and parents alike describe the heartbreak and helplessness of watching once healthy children become gravely ill, knowing that a simple, safe vaccine could have prevented their suffering. Measles is far from a harmless childhood illness. It's a serious, highly contagious disease that can lead to lifelong health problems or even death. These recent tragedies serve as a powerful and urgent reminder of why vaccination is so important, not just for individual children, but for entire communities. Protecting children from measles is not just a medical decision, it's a moral responsibility we all share, to ensure every child has the chance to grow up healthy and safe. The root cause of this outbreak is clear: falling MMR vaccination rates. National coverage among kindergartners dropped from 95.2% in 2019 to 2020 to 92.7% in 2023 to 2024, leaving hundreds of thousands of children unprotected. Herd immunity requires at least 95% coverage. We're now below that threshold. When vaccination rates dip, measles finds the gaps and spreads rapidly. This isn't just theory, it's happening now, with outbreaks in communities where immunization has slipped. The consequences extend beyond individual families. putting infants, the immunocompromised, and entire communities at risk. The lessen individual choices about vaccination have profound public health impacts. Measles is far more than a childhood rash. It's a highly dangerous and aggressive virus that can strike anyone, regardless of age or background. While many people think of it as a simple illness, the reality is much more alarming. Measles is one of the most contagious diseases on Earth. Just being in the same room as an infected person, even hours after they've left, can put you at risk. The virus lingers in the air for up to 2 hours, making it incredibly easy to catch. In fact, up to 90% of unprotected people nearby will become infected if exposed, turning schools, hospitals, and public spaces into danger zones during an outbreak. 1 in 5 unvaccinated people who get measles will be hospitalized, often with severe complications like pneumonia, brain swelling, or even organ failure. These are not rare outcomes. They happen far more often than most realize. For every 1,000 children infected, 1 to 3 will die, leaving families devastated and communities shaken by preventable loss. Survivors may face lifelong consequences, such as permanent brain damage, deafness, or other serious disabilities that can alter the course of their lives forever. Even years after recovery, measles can trigger fatal neurological disorders like subacute sclerosing panencephalitis, a rare but deadly brain disease that can appear long after the initial infection. The idea that measles is harmless is a dangerous myth. Underestimating this virus puts entire communities at risk, especially infants, the elderly, and those with weakened immune systems. Every infection is a gamble with serious, sometimes lifelong consequences. The risks are real, and the impact can be devastating for families and society as a whole. Vaccination is the only reliable way to avoid these risks. By getting vaccinated, you protect not just yourself, but also your loved ones and your community from the grave dangers of measles. In response, the federal government has issued a strong call for vaccination. Health and Human Services Secretary Robert F. Kennedy Jr. urged Americans to get the MMR vaccine, aligning with scientific consensus. While Kennedy opposes mandates, he emphasized the urgent need for immunization to stop the outbreak. The government's message vaccination is strongly recommended, not required. This approach puts responsibility on individuals and communities to protect themselves and others. Officials hope clear guidance and rising case numbers will persuade hesitant parents to act. The outcome depends on whether enough people choose to vaccinate and restore herd immunity. The MMR vaccine is our best defense, safe, effective, and trusted for over 50 years. 2 doses provide 97% protection against measles, and the vaccine's safety is backed by decades of research. Most children have no side effects. Serious reactions are extremely rare. Myths linking MMR to autism have been thoroughly debunked by global scientific authorities. The path forward is clear. Rebuild herd immunity by ensuring every child receives both doses on schedule. Vaccination isn't just personal, it's an act of community care, protecting the vulnerable among us. The MMR vaccine is the key to ending this outbreak and preventing future ones. With widespread vaccination, we can consign measles to history once again.